Great, thank you so much, and welcome to our three-part series on social determinants of health. My name is Justin Granat. I will be your host for this multi-session program. And the purpose of this program is to reinforce the burning platform on why social determinants matter, which we might intuitively know, but why taking action and taking more action matters now more than ever. During this three-part series, we'll start with connected communities of care during times of crisis. Our focus for today, and next we will address connected communities of care and the community health needs assessment, and finally, connected communities of care and bending the cost curve. Joining me today are two of HealthBox's newest partners, Keith Cosell and Leslie Wainwright from PCCI in Dallas. Many of you were likely tuned in last week when their CEO, Steve Miff, and our very own Neil Patel, president of HealthBox, discussed their views on the strategic importance of social determinants and how our combined efforts allow us to collaboratively support as many organizations as possible. So first off, Leslie and Keith, love for you to introduce yourselves.
Hi there.
Good morning. I'm Keith Cosell. Look forward to speaking with all of you today. Have spent the last 3 years at PCCI leading our connected communities of care initiatives and some of the population health work we do. Before that, 17 years at a company called Vizient here in Las Colinas, Texas, where I led most of our population health work and many initiatives bringing clinical programs and community-based programs together under both federal, state, and local initiatives. And I'm also an author of a book, Building Connected Communities of Care, with my colleague, Steve Miff. Leslie?
Great, thanks so much. And we're just thrilled to be with everyone today. As Justin said, my name is Leslie Wainwright, and I serve as the innovation lead for PCCI. And in addition to that work, I also work very closely with Keith around our connected communities of care, really trying to get this framework that we'll talk about today in the hands of as many people as possible. On the innovation side, at PCCI, I have a chance to work on our very early stage work and our partnership work. And we're just thrilled, as Justin had mentioned, that PCCI now has a more formal relationship in place with HealthBox. And this is one of many things that you'll see come from us over the coming weeks and months. Prior to PCCI, I've always worked at places that have acronyms as their names. Was very early on an organization called Avia that some of you might be familiar with, and spent a substantive amount of time at an organization called SG2, which is now part of Vizient. And again, my main role and the purpose for today is really to make sure that this framework of connected communities of care makes sense to organizations like yourself who are really thinking about social determinants of health, and importantly, how you take action on them.
Wonderful, and I should introduce myself briefly. I'm Justin Granat, Vice President of HealthBox, the innovation services firm that was acquired by HIMSS in March of 2018. And in our work in digital strategy in particular, we encountered so many health systems that needed help with social determinants. And while there were some good technologies out there and some good efforts, there was really nothing comprehensive what we're going to talk about today. So I'm going to start with what might be considered by some to be a bit of a bold statement. We really believe that a connected community of care is how you take action on social determinants. This connected community of care provides a truly innovative approach to facilitate cross-sector care coordination by doing a few key things. Number one, it enables community care partners to better provide targeted services to community residents. It reduces the duplication of services, which is just horribly inefficient and costly across all the partnered organizations. Then it helps to bridge the service gaps in what is currently a very fragmented system. And we're going to talk today about how that's been really highlighted and underscored by the current challenges. So goals for this session, we want to do really three things. Set the stage. What is a community care, a connected community of care? We want to talk about how these connected communities are important and necessary during the current pandemic with COVID-19. And then we want to open the floor for discussion. So if you have questions, please type them in the chat now or any way along the line. But before we get too far in the discussion, Leslie, could you start by providing some context on PCCI and the origin of this connected communities of care concept?
Sure, of course. So let me do that by first setting the stage with a little bit of like how we got here, or I always like to frame it as the why this, why now. And this goes back a little bit to my heritage at SG2, which actually began in that early 2000s. And many who were doing healthcare strategy and innovation work at that time recognized that the strategic imperative, or how you would differentiate as a hospital or health system, was really focused on this idea of a system of technology. And we were getting into the CT slice wars, and whether you had a 3T or a 6T Tesla, MRI machine, et cetera. And there was this idea that if we offered some of the most technologically advanced clinical care, that would be how we differentiate and provide maximal value. The Affordable Care Act comes into play. We recognize there's no way to really win that technology race. And it really became around trying to diversify a care delivery footprint to that lowest cost of care setting, trying to expand those access points, and really thinking about more bundled services kind of end to end. And then the strategic imperative really became, how do we improve those access points to as many ambulatory and non-acute care settings as possible? And we've been at that, frankly, and we're still